The recording. I'll do an intro. Hi everyone, and welcome to this fortnightly Tools of Frontline Staff session. We've got three presentations today. We've got Daniel who's come along from Skyway about an overview of what they do and how they work in partnership across the borough. Julia is here from the National Childbirth Trust to talk about some support for new parents that's available in Hackney, and then Sally is here from Healthwatch to talk about some support for mental health for fathers. So yeah, I'm going to pass across to Daniel. Please take it away.
Yeah, my name is Daniel, and I'm the Director of Development for Skyway Charity. So we're a charity that's based in Shoreditch, and we've been in existence since 2001. Pre-COVID, our work was specifically focused around youth work, but during COVID, we kind of changed and became more of a community organization. And since COVID, we've had to kind of re-look at how we do, and we've become a community, we changed our seminars to become a community organization. So at the moment, our work around the community and supporting the young people and kind of families is divided into three different kind of work. So there's the family and community support element. There's the goal setting, mindfulness and self-care and well-being element of our work, as well as the community outreach and information sharing. So I'll kind of go through some of those. For family and community support, one of the major piece of work that we do is community care package. So this is where we provide the most vulnerable families kind of care packages weekly of food, the most essential stuff that doesn't go off, vegetables and cereals, as well as kind of diapers and different elements of it. So during COVID, we used to provide roughly to about 380 families a week. Now we've cut it down to about 50 families a week. 50 to 60 families. We also started a cooking, kind of providing cooked meals and vouchers. So the cooked meals and vouchers program kind of caters for people that don't have the space to cook, the people that don't have enough electricity or they don't have the capacity to cook. So they would come, pick up a meal and leave. And then also supported by a household support fund from Hackney, we're able to provide roughly £3,500 worth of vouchers. And through this work, we kind of we also kind of started engaging with hotels around Hackney that cater for refugees. So we provided them space so for the people that lived there to be able to come and cook food once a week. And we have a community hangout space. So basically people can come in, cook food and sit down, eat, use the kind of computers, different access, as well as get support from staff members there to fill out forms, translations, kind of support them in different elements of our work that we do. So this is one of the major elements of our work that we undertaken at the moment. The second part of our work is the goal setting, mindfulness and self-care. So this is an extension of when we started COVID, because we were handing out food to kind of a lot of older group of families that weren't going out, people that weren't coming out of their houses. So we have a befriending program that's done through online, on the phone, and volunteers kind of going into people's houses and having conversation with the elderly. We have a one-to-one support program, which is specifically focusing around young people and parents, and young people kind of mediation between different groups of parents, as well as forming relationship between schools and parents. So this is a kind of intensive one-to-one work with parents, their young person, and then kind of bringing them together and then kind of getting them to go into the schools and challenge different things that are happening. So we use this one a lot more to address stuff around exclusions, challenging the schools, kind of a lot of our parents second language English. So we have, the one good thing we have is we have volunteers and stuff that are multilingual. So we can have conversations and kind of be the avenue for them to kind of challenge those different things. We have wellness sessions, that's 2 men's and 1 women only gym sessions running from our center. So one of the male sessions specifically for fathers that can come after they drop off their kids. The other one is for more general kind of young males that want to attend sessions for the gym that can't afford it. And 1 women's session, which is for women that drop off their kids, they can come and take part in activities, strength-based activities, more like a boot camp type of stuff, and a walking group. That one is specifically more kind of around getting people to get comfortable back to doing exercise so they can take it back at home and do the stuff with their kids as well. Yeah, let me go down. Sorry, I'm looking at my notes. We also have a brisk walking club. So this club is kind of short 8 to 10 weeks program. So we kind of recruit different people that need to do some walking that are not as active. So we engage them and kind of do walks around that specific area. So it might, for example, one of them would be around Phoenix Close, where we engaged about 7 or 8 kind of over 60s that are not really active. So we kind of take them for a walk and have a meet up in a specific cafe or something, have tea or coffee, and then bring them back to their place. We use this avenue to kind of talk to them about what's happening, update them on any kind of health information, kind of build relationships with them. So we at least they have somebody they can communicate to, and then also get information from and support from. The last part of our work is community outreach and information sharing. So this is based around the public health kind of community champions program. We've been active in that during COVID and since then. And through COVID, we managed to develop a massive kind of social media through WhatsApp groups for kind of different grouping of people. So we're able to share information quickly, let people know what's happening. People are quite interactive on there. So we've kind of developed that, and we have community champions that kind of go share information within the different groups, as well as young people champions that share information within their groups. So that works both ways. We share information out. Also, they bring in information and then guide our delivery and how we should kind of develop. So that's what kind of major work of what we do. We also do community events and sports days on a regular basis. We have 3 barbecues a year, 1 massive sports tournament for young people, 1 sports day for parents. And then we kind of, for different reasons, we also organize kind of street parties and that kind of stuff around where we are. So that's kind of our day-to-day work of what we've been doing and how we've been doing it since COVID. Since funding is not the same as it was during COVID for us, for example, it's gone down when it comes to community. What we've had to do is find a way of kind of expanding our work and reaching wider groups, but sharing resources. So we have 3 different models of kind of partnerships that are really successful for us. We have more, but these are the most successful ones for us. We have the first one, which is kind of forming a consortium of local groups. So this came because in Southwark, we run activities from Damilola Taylor Centre, and with the council, we had to agree on how we can get a lot of small volunteer organizations that are not constituted or set up with the infrastructure to run. And we brought them together and formed a kind of a consortium called Friends of Damilola Taylor Centre. And that's been really successful and running for 7 years. So we decided to kind of bring back an element of that within Shoreditch, and soon going to be fellows as well. And so what we do is we have about 5 or 6 small organizations that are not structured. There are more football clubs, volunteer-led, and we provide them back office support. We do the training for them. We do recruitment, kind of safer recruitment, safeguarding wise. We support them with that. And we provide them with space to deliver activities and staffing and offer them different things that they can reach out to their group. For us, there's a benefit because we reach out different groups, because some of the best organizations to engage the most vulnerable are the smallest organizations and the volunteer groups that work in that area. The second part is sharing resources to expand and reach wider need. So this is kind of, for example, connected us with an organization called Connecting Communities. They were in our area. We weren't really aware of them. Great organization. They do similar work to what we do around the food, cooking, and handing out care packages. And what we decided to do is we kind of formed a relationship. And then what we agreed was, for example, rather than me and my staff kind of go and do the shopping or do all of that stuff, what we would do is we would outsource that to them, and then they can kind of do that kind of stuff. And then we would do different parts. So what happened with that is they were able to kind of develop that process, that program, and we were able to focus on different things and do the same things, but in collective, which is really effective and allowed us to reach wider groups and kind of wider reach. And the other stuff that we do around partnership is it's about sharing learning and knowledge of to diversify our offer. An example would be the work that we do with Hackney Quest. So what we decided, because we were specifically we were quite experienced around detached and outreach, working with young people and working in communities, but we didn't have a strong background around working with families and kind of dealing different bits. So in order to learn how to do that, and for them to learn how to do what we do, what we decided to do was put one of our staff member to be based with them, and then they put one of their staff members to be based with us. So their staff member would learn to do detached, and our staff member would learn how to do family work. So once that's developed, we done it for about a year, and then that's led into wider kind of reach around working with reaching community to deliver different activities for both areas and expanding that work as well. And now I can say we're quite capable of delivering family work, community work based on that relationship and partnership and shared learning that we got. Yeah, that's what I got.
Thanks so much, Daniel. Brilliant to hear. And yeah, especially all of this really innovative work we're doing in terms of collaborative partnership working with other community partners. So yeah, thank you so much for coming along. I'm going to open up the floor for questions. Abby, I think you insert just an applause rather than a raised hand. If you want to come in.
Yeah.
Or does anyone else have any questions? Katie.
Is it me? First of all, it just sounds absolutely fabulous what you're doing. Thank you for explaining it. It's really inspiring and just great to see. It might be a bit of a boring sort of research question, but I'd be really interested to know how you evaluate and assess the difference that you're making.
We have an impact and quality person in-house in the organization. So all our projects have got kind of methodology, a fear of change, and how that's going to work. It's difficult to measure the impact when it comes to the wider community work. So, for example, if we're doing events and stuff like that, we wouldn't measure that. But there are people that are engaging for specifics, such as the one-to-ones. We use solution-focused therapy approach, which is scaling youth work observations or community work observations and kind of feedback from them. Mm-hmm. We use focus groups a lot of times. We used to do these forums. We decided to stop it because we weren't getting enough information, because we weren't able to provide them enough guidance on how to do it. So we started doing more around focus group discussions, so facilitated discussions, critical thinking sessions, and then they'll lead on that. So we have different methodologies of using measurement tools.
And you use that to then feed back into developing programs? Yeah.
Yeah, as well as that, we have the champions who kind of, to be honest, they lead the program. They come back and say to you, okay, this is great, but we've seen these people chuck away food over there. There's no point in doing it in this area. We need to change it. That's okay, so how do we do it? It's quite good to have that kind of underground feedback and people.
Yeah, really flexible. Brilliant. Thank you.
Cheers.
Thanks, guys. Penny, do you want to come in?
Penny, Penny.
You're on mute. You're on mute, Penny.
You're on mute, Penny.
Sorry. Yeah, you're cramming in so much. It's amazing what you do, and yeah, all the projects that you're running. So I'm just curious to know what systems you're using to manage all the volunteers. Have you, other than WhatsApp, like, have you got any systems that you're using? To be honest with you, we don't have as much volunteers as you would think. For example, we have 2 full-time staff that work on this, and every year we have 6 champions, and the 6 champions, we have about 5 or 6 people that work on this. So it's not as much as everybody. Like some organizations have got 50, 60 volunteers that they're managing at once. We don't really do that, because what we decided was I want to have volunteers that actually have stuff to do rather than just kind of bring them on and give them 1 hour here, 1 hour there. Yeah. So we use the same management structure that we have for staff. So there'll be a staff member allocated to manage the volunteers. They wouldn't get supervision, for example, every 6 weeks. For the groups of volunteers, for the 5 that are under the champions, they would get once a quarter group management kind of supervision, and then the champions will get monthly supervision around what's happening, what needs to happen. Yeah. So that's what we do. Yeah, and what platforms do you use for that, to manage that?
We have Views platform that keeps all their data, but we don't really have a specific platform to manage all that stuff. Right. We use spreadsheets, basically. Exactly.
Yeah. Okay, that's interesting. Thank you.
Yes.
Thanks, we're based in Fellows Court, by the way, so it'd be nice to come by and
please. Yeah, today's our first session over there, so we're going to be there from today.
Oh, excellent.
We're going to do outreach and also deliver center from the center as well, activities from next week.
Excellent.
Good to meet you, definitely.
Yeah.
Brilliant, and thanks, Charlie, as well. Jenny, do you want to come in?
Yeah, thank you. It was a brilliant presentation. It's just, yeah, it's great. So great to hear about the work you do, and great to connect you up with others like Penny. I had a few questions. The first one was, which day is your drop in? Because I'd love to come along. Friday. Okay.
Fridays. Yeah.
Okay. That's
Friday.
easy. On Fridays. Okay, I'll be in touch on that. The second one was that if there was one thing that if the council did differently, or that statutory partners did differently, that would make your life easier in the work that you're doing, what would that be? I guess for you as an organisation, but also for the residents you're working with,
I think it's something I say all the time. I think we really need a mapping exercise of what's actually happening in the areas. I think there's lots of duplication of activities happening. Like, for example, us and Connecting Community are literally right next to each other. We didn't know anything about each other. We were working with similar groups. Some of the people were coming to us and going to them. So I think there needs to be a kind of a mapping out of activities and saying, okay, this is happening here. How do we connect them? And I give credit to Charles, which he does a lot of that for me as well. I think that's really good. I think that's the biggest one.
So it's connecting up the existing resources so that you're able to work in more collaborative, do more of that kind of partnership work where you're like you are with Connecting All Communities.
Yeah, definitely, because all of us started something during COVID, and nobody's trying to let it go or leave it. We're all trying to build on it, even though it changes in form. But that means I'm doing the same thing as someone else is doing the same thing, when we could actually be referring to each other, supporting each other, and how we do that. I think it's a big one. Definitely.
And making better use of resources. That's really interesting. And are there things that you're finding is really hard to help residents with at the moment? I mean, I know that housing is always the biggest one, and one that we can do least about. And we know that many of the people that you're working with are going to have financial challenges as well. But I guess intersecting with that, are there other kind of key things that feel really hard to get help for residents with?
At the moment, food is the biggest one for me. I think I've got a lot of families that need food, and I'm having to look at who are the most vulnerable sometimes. And I think that's a problem. I think it was great with the Household Support Fund. We had some funding. It's meant to be extended, so we're still waiting to hear back on that extension. But once that comes in, that will make a difference. But I think, for some reason, it feels like to me where since COVID's finished and some stuff has happened, we all looking at it like, okay, that food thing has kind of got easier. I'm finding it's got a lot worse. I think we have a lot of people that are struggling with food poverty, and a lot of people that are not as comfortable in asking for support for food poverty at the moment. So I think there needs to be something that's kind of concrete around food. That's really, it needs to happen. I think it's going to get worse and worse. We're seeing, especially in our youth clubs as well, some kids are coming in completely hungry. It always happens in some ways, but you can see the difference. I think nothing's got better with that, definitely.
Yeah, I'm sure there are many on the call who I know we have Ali and we have Penny and Joycelyn on the call. I'm sure that chimes with their experiences. I don't know if they wanted to share anything on that or had any other reflections. I'm sure there's other questions as well in the room, but thanks, Daniel.
Yes.
Thanks, Jenny. Does anyone else have any other questions for Daniel? I was just going to encourage you to continue coming along to these meetings if you're able to, Daniel. Must be extremely busy, and feel free to come when it suits your calendar. Great to have you here and be able to make some of those connections as well with other organisations working in the same space. Charlie.
I was just going to ask about that, about like making the connections and trying to make that work, because obviously like I do quite a lot of that mapping and try to link people up where they're in place, and we have sessions like this where we try and get people to understand each other, and we do a lot of that kind of connecting here as well. I was just wondering if there's anywhere else you think we could be doing that. It's just I only have so many arms, if you know what I mean.
I think there's two parts to it. I think there's parts that you can, for example, you do it through infrastructure grants, and because you're aware which organizations are working where. I think there needs to be a piece of work done by the Hackney by the HCBS that looks at what's happening and where, because we all feed into that as well. So it's not just a council piece of work. I think this needs to be done in a wider context. When we're looking at public health with that, there's a lot of information about different organizations gathered by these different bodies. And what I'm seeing is there is no connection between them, or there's not enough connection between them. I think there needs to be something that collates that information and looks at it on a wider context and say, okay, this is here, this is here, this is here. Public health information or champions are missing in this area. So how can we transfer some of this overcrowding from this area to this? I think there needs to be that piece of exercise done, but that's not just the council. It's got to be done in partnership with the CVS, with the partners that are kind of involved in different things. And then also there's got to be willingness of people to say, this is what I'm doing. I think so. It's not an easy task. That's why I kind of keep on bringing it up all the time. So like, all right, I understand.
I was just going to say that's really helpful feedback, Daniel, and it's really helpful to have these sessions recorded so we can share this with people, because there is going to be somebody, a post who's going to be working on the Find Support Services map funded by Public Health that we'll be working with. And I think that's a really important role for them to do that linking up. And I think once they're in post, hopefully there'll be more kind of space. It's been quite a long time since that's been updated or worked with since the pandemic. So I think you're quite right in terms of that linking up, and all of Charlie and Hannah's work in sort of mapping and all of the insight that we've gathered from these sessions will feed into that. But also there's an opportunity, I think, to link back with HCBS and all the other key organisations working with partners to try and make more sense of it. So that's really helpful. Thank you.
Thanks, guys.
Thanks, guys. If we don't have any more questions, then we can move on to Julia. But yeah, thank you so much again, Dana, for coming along. And if you've got like flyers and things like that, like links to things online that you want me to share in the newsletter, I'll put a link to your website in the next one. But if you've got like specific programs and things that you've got comms for you want me to link to, just email me and I will make sure I put them in.
Cheers.
Great. Thanks a lot. Right, we're going to move on to our next presenter, which is Julia. So yeah, take it away.
Thank you. I have done a presentation, but I'll just talk through it and then share it for you all to read after, because there's nothing worse than seeing a presentation and hearing the person reading it. So yeah, some of you would have heard I work for NCT, so National Childbirth Trust. NCT is our acronym. A lot of people think NCT is a charity that provides antenatal classes that you pay for, and what we do at the moment couldn't be further different than that. Yes, there is that element of the paid for services that people can access, but what we're doing in the Borough of Hackney and in a lot of other areas is a commissioned project. So we're commissioned by Hackney Council to offer 2 strands of support to parents. One of the biggest parts is the infant feeding support. So that's supporting parents with any element of feeding their baby in community-based support, in the hospitals and on telephone support. And then the other element, which I'll touch on afterwards, is the EPEC. So it's Empowering Parents, Empowering Communities, which is like a parenting course. So it's something where we recruit families to support other families. All of what we do is a free service, because we're commissioned by the council. Everything we offer to the families is free. So anything that they come to, they wouldn't ever have a charge. We try to put what we do in areas that parents can get to as well. So it shouldn't be that they have a huge amount of travel to get to any of our services either. So we try to make them very accessible. The infant feeding part that we're doing, we've been in Hackney now since January. We received our funding through the Family Hub's government funding. 75 areas in the UK got this funding, and Hackney was one of them. So we were lucky at NCT to be given that funding to work with Hackney Council to provide this. The infant feeding support, a lot of people look at that and think it's just breastfeeding support, but it isn't. A big part of what we do is at breastfeeding support, as that's something that a lot of families need more support with. But we also offer support for formula feeding, mixed feeding, when parents decide to move on to solid foods. So any element of where they might be needing some support with their feeding, they can come along to our groups to see our peer supporters. We then also provide emotional wellbeing support around anything we do, because families, obviously, where they're having anything they might have a struggle with, often emotional support comes alongside that without them realising it. They'll come along, they'll think they're coming to talk to somebody about how they might add in mixed feed into their baby's journey, and then everything else pours out. All their day that they've had, their bad week that they've had, their worries and their concerns. So what we do is not just it's called infant feeding support, but there's so much more to it. What we have got going, when we started, there was one group within the community. We've now got 4 groups. So we've got groups at, so they're on a Tuesday to a Friday across the borough. The Tuesday one is at the Ann Taylor Children and Family Hub. The Wednesday one is at the Daubney Children and Family Hub. The Thursday one is at Woodbury Down, and the Friday is at Lyndon. So we're spread across as well at the 4 main hubs. All the drop-ins that we run are an hour and a half long, and families can just drop in, come along at any point, even if it's 10 minutes towards the end. We quite often have people falling through the door just towards the end because they've just got there and realised they needed to ask us lots, and we will see every parent that comes. The idea of them is we can provide support for a specific question, or we can provide support just by them coming in and meeting other people, coming to get to chat to other mums, coming to have a chat with us about a question, and then we might link them with another parent who's going through a similar situation to them. So they're real support building sessions as well. So one of the big aims that we try to do is to get those parents out of that social isolation. So if they're struggling and they might be finding it that they don't know where to go, we encourage them to come back every week to meet people, to talk to people, and get those connections with other families as well. So alongside those groups, we will be offering telephone support and peer supporters within the Homerton Hospital. That's something that we're building at the moment, because obviously there's a lot of red tape to go through with getting volunteers onto the wards. That should be launching next month. So parents will see us at that point of their journey as well. Again, all completely free and complementary to the health services that are run. So there's midwives and there's health visitors doing a lot of support for families in the borough. We're there to just complement that. So our peer supporters aren't as medically trained as those medical staff, but they can give that emotional support, that listening, signposting, helping families to get to the right element of their medical journey that they might need to get to. Something else that we're adding in that will launch next month is our equipment hire scheme. So often families need to use breast pumps and can't afford to buy them. So something that Hackney Council has asked us to fund as well is an equipment hire scheme. So families can come along and hire a pump from us for as long as they need it, whilst also getting specialist support. So if they come to get a pump from us, we would make sure that they are in with their health visitor or in with their midwife to be getting that specialist support that they would need whilst they're using it. And then another option that we're going to be implementing with the infant feeding side of it is walking groups. So if families are feeling quite anxious about coming to one of our main groups that are in the centres, something that we're going to add in as that step before that is like a walking support group. So come and meet us, come and find out who we are, come and ask a question. And if those parents are quite anxious, sometimes coming to that is easier. So that will hopefully be a nice lead into our group support as well. Just checking I've not missed anything on that one. No. And the telephone support option is at various points during the family's journey. So we start by calling them at 48 hours post-discharge from hospital just to find out how they're getting on. Often what we do is signpost them to services outside of what we run. So it might be that they say, I don't know when I'm going to see my health visitor. So we signpost them to the rapid response line for the health visitor so they know how to go and get their support from their health visitor. They might say, I'm finding everything really hard, and we would signpost them to the hub for that support, or we might signpost them to some of the other services for that food-based support, budgeting support, things like that. We always make sure that we can equip our peer supporters when they're talking to those mums to know how to get parents into other elements. If we're often their first point of contact and they ask us that question, we need to be able to signpost them into those. And then the empowering parents and parent communities side of it is essentially a parenting course, but what we do is we train local parents to support local parents. So it's a 10-week course that the parents, so what we train what we call parent group leaders to run a 10-week course to other parents. So those, what we call parent group leaders, who we will initially recruit and train, they get incentivized to run it. So it becomes an incentivized volunteering journey for them, but also a career building journey, because they get our training, they're then running a course, so they're getting all their CV building, so that when they're then at that point where they're ready to find a job, they've got a lot of evidence on their CV that they've been doing something regularly, and a lot of their training goes alongside there, so they can use that as a career builder as well. And then when they're running the courses, so they're 10-week courses for families, it's designed to empower those parents to find out about their child's development and use that in a positive way. So it's all around social skills, points of how they can parent their children, how they might go and get some support and help in something. A session that I watched the other day, there was a family came in who were going through the special needs journey, and 2 other parents were on there who were also going through it, and you just watch them wrap each other up and support each other, and it becomes a peer-led service that those families are supporting each other in. So the EPEC will be starting in September. So we're at the moment we're recruiting those parent group leaders to train, and then when we've trained them in September, they will start to offer that service out to the families. So it's new, we're building in Hackney. It's something, obviously Hackney hasn't really had an NCT presence before, so getting that name out there is one of the hardest things we've got at the moment, and getting parents and the healthcare professionals to know who we are. We're working really closely with the health visitors and the midwife side of things, and it's just getting those parents to know that they're coming to a support service and that they will be welcomed with open arms, come in, helped, signposted, give them whatever support they need. And yeah, we're just hoping to grow and keep getting out there a bit further in Hackney into other areas. Something that we are really proud of as well, that we're going to be starting next month, is we're working with Jump, so to offer 2 groups within the Haredi community. So they were already running 1, and the council have funded so we can be running 2. So we will have members of the Haredi community train with us to support other members of the community with feeding support as well. So that's something that's a real benefit for us, to know that we can work with Jump to offer that for those families in a culturally sensitive way that they can access. I think that's it. It's probably a bit quicker than you needed it to be, but hopefully that's given a nice overshot.
Yeah, no, that was perfect. Really, really interesting.
I'll share my presentation so you can send it out after.
Yeah, sure. Yeah, sounds like some really powerful work happening. So thanks so much for presenting. Does anyone have any questions for Julia? Charlie.
Hi, Julia. Thank you for the presentation.
That's okay.
I guess I was interested in what the plan was around kind of building up your signposting network. Hackney has a very rich and very innovative voluntary sector. And
yeah.
How are you hoping to understand that as part of how you work with the area? You know, and like, what kind of places are we hoping to find information? That's kind of what I'm curious about.
Yeah, so we've got a member of staff, Sandra, who's working on the EPEC side of things, and she's doing a lot of going out there and building those resources with people. She's doing a lot of work with Shoreditch Trust, going out and meeting all the hubs and finding out where she can get in there to advertise our services out to people, make networks, make links. What our main part at the moment is to get the team full down there. So obviously I'm covering the service delivery manager side of it at the moment, but we have a new person starting next week. And then what she will do is just hit the ground running, find out where we need to be, go out there and make those links. We have started to make links with the Council for Voluntary Services. There's a few areas that we've got out there already, but there's a lot of work to be done. A lot of information finding and sharing out there.
Great, thanks, Julia. Any other questions? Jenny.
I suppose mine was a bit linked to that, but also I was just really, really pleased to hear that there was some thinking about those parents that might find it difficult to come into a hub to access that support.
Yeah.
But also curious, I suppose, to Charlie's point about how community partners, some of whom are on the call, who may be working with families who could benefit from that support.
Yeah.
What opportunities are there, or might there be, for your service, you know, for there to be some kind of link, some kind of outreach, if there was a parent who was who had an existing really trusted relationship with somebody, they were coming for food support, for example, and didn't necessarily want to come into a hub or even go to a walking group, felt a bit much. Are there ways that, you know, given the resources and supports that you have, and I'm sure that community partners come across people who might be interested in being volunteers as well, who might have volunteered in food, and might be interested in doing that. You know, how yeah, how, you know, what kind of scope is there for that? And I suppose I'm thinking about some of our colleagues on the call, like we have Joycelyn here from Shepherd Fold Ministry, and I know that sometime there were quite a lot of parents with children under 5 that we were that Charlie and colleagues were linking Joycelyn with other organisations around support with. But I suppose we find in Hackney that so much of you know, when people are feeling a bit fragile and they really are the people that need the help the most, it's really hard to get, you know, once they've got a good connection with somebody, that's where they want the support, and to be referred or signposted often just feels like it's a bit of a stretch too far. So are there any kind of thoughts that you've got on that? I'd definitely encourage you to make use of the contact with Charlie and with Hannah around the mapping they've already done. So like, so repeating things, and we can build on things, because I know we did also did some work with the Children and Family Hubs looking at which organisations in the whole borough were doing stuff to support families under 5. That work, so all that info's there, but there's nothing like a warm handover. Like, is there are there potentials, for example, for one of our community partners to kind of have a call with somebody and to kind of arrange some other way of supporting somebody's access, stuff that might help?
Yeah, so most definitely when the new person comes in, that's one of the things they'll straight away start doing, is going out there and finding the meetings she can attend, who she can link with. We do have peer supporters in our groups, but we're also very open for peer supporters to coming to things as well. So if there's an established group where you think a peer coming to that to share information would be good, or us to, we do another service in other areas which we can add some of into Hackney, so we have like a befriender scheme, so a peer might be linked one-on-one with a mum rather than just going along to the groups or something. It might be that you think that one mum would really benefit from a chat with one of our peer supporters, and perhaps in the situation where you linked them and they were with that person as well as our peer. So we're always open to whatever will work for the families, whatever will work for the areas. We're really aware that Hackney obviously does have a lot of areas. It's not just a one-stop shop where we can have a group in one place and that will be the only thing that works. It's going to evolve, and it's going to become, like we've found with the Haredi community, it's not just putting a drop in on, it's the right day and time. It's all so many considerations. So when the new person comes in, which will be June, they will be out there making all those links. So it'd be really good. I'll put them in touch with you, Charles. Thank you.
Great, good stuff. Penny, do you want to?
Yeah, hi Julia. So I already know of like a mum who's struggling now, for example, which I think if I just sent her the link and signposted, I don't feel like she would reach out.
No.
Like, is it something where you do home visits?
Yeah, so there is the option to do some home visits or even a telephone call or text messaging. So if like an initial, just dropping a text to that mum. So on the presentation that I send out, it's got our email, so Hackney support email. So anybody like that you would want to link into us, we can do it that way, and we can find a way to link with that mum before, even if the goal is never to get her to a group. It's just to spend that one-on-one text messaging into a phone call, into a gentle chat with her, or going to meet her at her home. By all means, we can work out what we can do for those people.
Because without Davide, and she's already expressed that she'd like to connect. She's new to the area. She'd like to connect with like local groups and stuff, and this would be ideal for her, especially with the walking groups that you'd mentioned. And getting her permission to connect, obviously with your support. But I don't think she would do the first initial reaching out.
It's a real trust thing.
Yeah,
you've got to build a parent's trust like that first, and spend a bit of time getting to know them, and then arrange to meet them first, and then the next time might be you go on the walk, or the next time might be let's just go and see where the group is. Like, build it up slowly for those mums. So not just we know that everybody's not just going to come walking through our doors. It doesn't happen.
Okay, that's good to know. Then I'll definitely send an email across. Thank you.
Thank you.
Great, thanks, Penny. Does anyone else have any other questions for Julia? Or we can move on to our next presentation. Great, thanks so much for coming along, Julia, and glad you've been able to make some connections later. And feel free to carry on coming or come back again in a couple of months' time and present again on progress. That would be great.
Thank you.
Cool. Right, we're going to pass over to Sally. So please take it away. You're on mute, Sally.
Good spot. So I was sorry about that. I was just trying to pop in the chat a couple of flyers, but I don't know if those have come up as links or not. If not, I will share them afterwards, I wanted to talk to you very briefly about a project we're doing and a training opportunity that is connected to the project. Healthwatch Hackney does quite a lot of different things. As you know, we're all about co-producing, working with residents to give them a voice, make sure they're involved in shaping services. This particular project, we are working on perinatal mental health. When we think about perinatal mental health, I think people normally think about mothers. And we know that that is certainly the case within the borough, that there is quite a bit of support out there for mothers. And we were asked to have a think about what that looks like from the father's point of view. We were asked to have a think about, are there services that are missing or that need to be expanded? So we've been doing a bit of a needs assessment in true Healthwatch Hackney style. We've been doing it in a co-produced way. So we're working with some local fathers to understand what is the experience of fathers from really conception, so throughout that pregnancy stage as well, but then from birth up until 2 years old. Is there support for them? Is there an understanding of those really quite specific mental health needs that they might have? Thinking about the kind of parent-infant relationships as well. We know if fathers are looked after and supported to be the best they can be, the knock-on effect is, you know, their babies, their little ones are getting the best start in life. We're really, really excited about this project. One of the things that we are doing as part of this project is we think it's really, really important that people that are on the ground working with fathers have an understanding of what do we mean when we talk about perinatal mental health. What does that present as? What does that look like when you're working with a dad, when you're chatting to someone that's got a young child either with them or a child at home, or potentially a young child that they're not living with, but they are trying to have contact with or have got contact with? How can we recognize the kind of those red flags? There's something here that needs some support, and what can we offer? Where are we signposting these guys to? So we've got a couple of trainings. They're both kind of full day trainings, so 9:30 till 4, to really help people that are there doing that work out with residents to understand perinatal mental health in dads, and how can we support? What can we do to help? One of them is an awareness training. So it's really that out on the ground type training. One of them is a champions training, which is more about it will give you the skills to recognize the signs, to understand perinatal mental health, to know how to support, to know how to signpost, but it'll also kind of give you the ability to take that back to your team and to share it with your team so you can be the champion for your organization. And I just think, I mean, even just listening, we wanted to come and talk to you today because I think that this is the right group. A lot of you guys are out there doing that work, and just listening to the presentations, you know, I think Julia, Daniel, your people are the people that are meeting with the dads, with the parents that we're trying to reach out to. We've got some spaces. The two trainings I'm talking about, they are. One is quite soon. One is, I think, I'm going to double check, make sure I don't tell you the wrong date because that would be awful. But we have got one training running on Tuesday the 21st. That one is online. And then there is another training 2 weeks after that, which is Tuesday the 4th of June, and that one is in person. One of the things that we're doing, because I'm really, really conscious that for me, I really, really want as many people as possible in Hackney to get this training, right? Because I want us to be out there supporting dads. Very conscious that to ask you guys that are out there doing all that support work to give a full day of your time to come and do training is a really, really big ask. It's really difficult to know how to navigate that. One of the things I have done is put in £100 payment to your organisation to kind of backfill your time. So if you come and join us for the training, that will backfill your time. And I'm hoping that helps to just think about, I guess it's a way of almost me showing, I know it's a big ask, because I know that when you people are out there doing the work that you do, to give a full day to come to training is a lot to ask. And it's a way of showing, look, we appreciate it, and we think it's really important that you join us if you can. That's it in a nutshell. I can give a little bit more detail about the projects or about the training, but I just wanted to put it out there really, because what I found is when I send flyers out, people get so many offers of training and that on flyers that it just kind of gets pushed to one side. So I guess I'm going to just come here and say to you in person, I'm really excited about this training. I think it would be really beneficial. I would really love it if any of you guys would be interested in signing up. Okay.
Thanks so much, Sally. Any questions about the training or ideas on maybe how we can share it even further? Penny, do you look at it? I think maybe that was a legacy house from before. So
Sorry, old one, yeah. Old
Yeah.
one.
yeah, okay, no worries. Krista.
Hi, thank you so much, John. Just to add on to Sally's father friendly, I've got 1 week left on my breast cancer research. So please, if you can share the flyer again for me for 1 week for that, if we're just having a Healthwatch moment. And my brain just actually went foggy off father friendly. I was thinking, oh, maternity, we're in children mode at the moment. If anybody knows any Turkish or Kurdish community people that would be interested in coming forward as a representative for Maternity Voice, we'd be delighted to have them. So we had a couple of people lined up, but they can't commit anymore. So just putting feelers out to the community whilst we're speaking about parent stuff, particularly looking for a Turkish or Kurdish rep for Maternity Voice, please. Thank you so much. Thanks, John.
No worries, thanks, Krista. Any other comments or questions on anything we've just heard from Healthwatch and the training opportunities? Joycelyn.
Yeah, Christy, I want to find out what information do you want me to share with them, because you know they have language barriers and they find it difficult to.
I've got a couple of Turkish Kurdish flyers that we've had created, Joycelyn, so I'll put a note in my diary and I'll get them over to you tomorrow, if that's all right.
Yes, please, because I have a few of them in our food bank and I believe they might be interested, but how to communicate with them.
I'll send you that through tomorrow, and I'll send the Turkish and the English versions of the flyer over, Jocelyn, yeah, so you can share them with everyone. Also, just it might be worth mentioning, John, just because there's a lot going on in the borough at the moment. We've got a hate crime champion training with Bennett and myself being delivered online on Friday, the 31st of May from 10:30 to 12. If anybody's interested, I'll drop. It's quite good for professionals, again, residents and professionals. We want as many people sort of as strategically placed in the borough that know what to do and can advise their communities they work with. So I'll drop my email in the flyer in the chat now, and if anybody wants to sign up, do let me know. Thank you. Thanks so much.
Thanks, Krista and Joycelyn.
Krista, are you able to share the flyers with me too, please?
Yeah, I'm going to stick it in the group chat now. And if you can drop your email in, is that Daniel? If you could drop your email in, I can make sure you're on the mailing list as well. Thank you.
No worries.
Jenny, just looking in.
Brilliant. Yeah, firstly, I just wanted to say what a great programme, Sally, and Healthwatch in general. I think it's really it's been a really important gap, and I know it'll be a really helpful initiative. I think one of the challenges is with so many of these trainings, we know that so many people are in a really good position with those relationships, but finding the time to go to trainings and get that support is really hard. So I suppose I just wanted to invite all of you that are doing trainings, if you want to run something in this session, speak to John, because we could do a bite-sized version of whatever trainings you're offering to give people a flavour or to upskill them to a certain point as a way in, because I think we are trying to do as much, we're trying to equip frontline staff, those working with residents, through these sessions, but we often hear, I can't go to another training. Of course that's relevant and important, and of course I'm working with people in that situation, but meeting fatigue, training fatigue, finding time in the day is a real challenge for so many people working directly with residents, because it's so it takes time away, doesn't it, from the work. So if you have any sort of short bite-sized ways of delivering training in this session or sharing knowledge within the newsletter, then please do a version, because it does reach quite a lot of people. We don't know.
I'm sure I can speak to Bennett and maybe arrange something, because I'm now delivering workshops with him, kind of thing. So let me speak to him and I'll come back to John on that. No problem. Thanks, Jen. No problem.
Yeah, and we'll put whatever in the newsletter. So if you've got recordings from other trainings you've run, or presentations, or anything that just gives people a flavour of what the content is or how they might use some of it. And similarly, Julia, with the NCT work, if there are things that are helpful, please do share it, because I think we do get quite a good readership with the newsletter, and we know that people watch the recordings later. So yeah, do use this space.
If I speak to Bennett, I'm sure we can arrange doing a brief presentation to the group on the hate crime stuff, just to bring them up to speed on what's going on, and also the correct signposting procedure if they're residents. It's more for, we know it's hard for professionals to get to loads of training, but I would say my last batch was half residents, half professionals, and any residents that are like volunteering and working in their community, they're the people that are often the advice people that people go to for advice on grassroots. So any kind of residents that anyone knows that wants to do it are more than welcome. It's open to residents and professionals. So I'll stuck my email in the thing and I'll make sure everyone gets looped in. I'll have a chat with Bennett and see what we can arrange to deliver at a session and liaise with John. Yeah, no worries.
Great. I'd also just ask if with any of these sort of peer support roles or any of these, anyone working directly to support residents, whether they're, doing that in a voluntary capacity or as a peer support, is very welcome to attend this session and might find it useful and connecting in with others. So do make sure it's on their radar. And I was thinking, Julia, about the NCT, the peer support once people have done the training, that this is a really great resource for people because they can come along and say, where do I go for this, and do you know anyone who does that? And
they can also, I lead on the resident engagement community of practice, so the link is on my footer of my email, so if anybody emails me, they'll get the reply, and then there's a sign up link on their quick Google form, and that means they'll get all the updates and anything we're pushing out to do with resident engagement anyway. The first newsletter with a couple of lunch and learns and stuff like that, all the upcoming dates for the year, is going to be released on May the 28th. So if anyone wants to sign up in time for that, and then they'll have the calendar of events, just drop me an email and we can get you registered. All right? No worries. And Daniel, I've got your email. I'll do that tomorrow for you. And Joycelyn, thank you. Thanks, John. Thanks, everyone.
Thank you.
No worries. Does anyone else have anything they want to share at this space? Or any other questions for Fanny? Charlie, do you want to come in?
Hello, everyone. I was just going to say, I've joined today from the Welcome Hub, which we're running for refugees and migrants at the Dalston CLR Library, which is 2 till 5 every day. It's 5 now, so everyone's gone. But if you weren't aware of this service, I just wanted to let you know that it's existing. It's got a variety of professionals here to support refugees and migrants across different spots. We've got housing advice here, some employment advice. I was sat next to someone from Hackney Works. I'll be here to be a kind of community link kind of person, linking people into voluntary stuff. So if you do have any refugees and migrants you're working with who you think could benefit from that support, there will be people here 2 till 5 every Thursday, every week. And if you want to give them a name, I will try and be here most of the time. But there's also loads of great people here, and I can link anyone who wants to be linked up. Let me know. Just a plug for it. I think Eden's presented on this before for this session, but it's up and running. It's going. It's great.
Nice one. Thanks, Charlie. Jenny.
I'd totally forgotten that you were broadcasting live from there, Charlie, but really, really glad to see that it's all happening. Have there been many people showing up today? Or I know it's hard to get the word out, isn't it?
We're early doors, but there's been a steady stream. It was more than last week, and it was more than the week before. So we're
great.
There we go.
Brilliant. And we really want to know from you all what residents we're trying. I think the idea is that because we don't know what support people need in the hub, we're trying to have those conversations now. The team down there, Charlie and others, and Eden's team, having those conversations with residents as they come in. But if you've got ideas about what would be helpful to have in the place, if you were going to, if you're working with a resident and they need a particular thing and they are, that they might benefit from the hub, it's really useful to know, is it they need to speak to someone about, school admissions, GP, what are the things that people need help with? Because then the idea is that we then look at how we can bring those people to the Welcome Hub rather than just bringing everybody down. So any ideas you've got, any feedback, suggestions, obviously we'll be hearing from residents directly, and there are interpreters there, aren't there, also, Charlie?
I think for some, and then they have a strategy around kind of other languages as well.
But any ideas about what's helpful and help us make a success of this, that'd be brilliant. I'm so glad that Ali's got her hand up too, because I was hoping to hear about what's happening with Caribbean.
Thank you so much. I've got 3 kind of updates. I'm going to start with the last one first. I just wanted to say, I don't know if this is the right place to share it, but I've been part of a group that meets every Friday with Bapinda, and I just wanted to say that it's been a great space and so needed. So if I'd love to chat with whoever kind of organised that to just give some more feedback, because yeah, I didn't realise I needed it until I got it. So I just wanted to say that. The second thing is, as I shared on the last meeting, that Caribbeans has got a space in Dalston. I've got a really quick turnaround to prove I can do what I said I can do, which I know I'm going to do. Last week I was there on Tuesday. I'm going to be there Monday and Tuesday. So I'm just letting people come and visit and just see the space, and just, I can say things, but you need to be in the space, right? And I'm really chuffed the support I'm getting and how the news is getting round. So please email me and yeah, just pop in and pop round. I really need some help with the garden. That's first priority. And the last thing is, with my boiler house hat on, we've got an event on the 30th, and that's really sharing about the journey of the boiler house, what's gone on, where we are now and the future. So I'll be sending an invite out to people very, very soon. But I encourage anybody who is in the immediate area and the wider community to come along and just hear about the journey. And there's something that we're going to share that may be of interest to people about using the space. So yeah, again, email me about that, but I'll be sending the invites out. That's the 30th of May at 3 p.m. Here at the Boiler House. Thank you so much. Oh, volunteer gardeners. Thanks, John.
Also, ask the VCH lot, ask Volunteer Centre Hackney, because they have team of corporates, Ali, that can come in and maybe do it for you. You know, like, get a corporate team to come in and do that. A corporate team will jump all over that. It's a nice bit of PR for them and for you. So if you speak to VCH, speak to Jane Tyler at VCH and see if she can hook you up with a corporate team, because they pay for everything as well. They pay for everything you need as well. It's a win-win.
yeah, that's definitely on my list. To reach out to them. I know there's some boxes I've got to tick to be able to accept corporates. So I don't know if I'll be ready in time for that, but definitely it's on my radar. Thanks for that, Krista.
You should also shout out to all the people that have eaten with you over the years. I'm sure loads of them would love to come. All the residents would love to come and help you do your garden, and be surprised, like, a lot of them are actually really talented gardeners, so the older people. So maybe that would be a shout out as well. Let the residents build the garden for you, maybe.
Yeah, so we really need to get the garden sorted, because summer's coming and the plan is Friday evening is going to be games, dominoes, jerk, and a bit of music. So I'm so excited, and I just want to say thank you to everybody who's emailed me, messaged me, and just said well done. I've not done it yet, but the hardest thing often is getting the space. So thanks for all your support.
Nice one, thanks, Ali. Charlie.
I was just going to say, I know Penny and Idiots has had a great luck with corporate volunteers as well, so maybe you guys could chat about that. I know I'm putting you on the spot there, Penny, but I know you've had some success on that front before as well, so it might be something to think.
I can throw in here that maybe I could tell you very off the record that if you approach a big accountancy firm called Mazars in Tower Hill directly, I may have just dropped that in. It's not being recorded. It's being recorded. I'm finished. And if you approach Mazars, I know Mazars do a lot of corporate stuff, and they allow people to. They're a big accountancy firm, Tower Hill, and they let people from the community approach them directly for their help. So maybe hit them up direct.
Thanks, Krista. I need these little contacts. Thank you.
Well, it's not what you know, right?
Thanks, Krista. Yeah, this is really now just the open space that we usually have towards the end of these meetings, where anyone can come in with something they want to promote or something they want to ask the group about. Penny, your hand went up and then went down. I don't know if you want to come in or not. You're on mute. You're on mute, Penny.
Sorry, Ali, are you connected with FareShare? Do you get any food from them?
FareShare, no. The Boiler House, we get it from Felix. No,
because if you sign up with them in general, it takes some time though. You might not get it in time, but it's good to be with them. So obviously, if you collect food from Tesco or anything like that, once you get in with them, then you can sign up to their corporate volunteer program. But you might not need to get the food from them to be part of their corporate volunteer side of it. And then separately from that, we've just signed up with Matchable, and that's working out really good. Matchable is a corporate volunteer program that we've signed up to. They're really good. Dead easy as well.
I'm going to email you, Penny. All right, we'll have a
Yeah,
chat.
I'm not available on the 30th, unfortunately, but I'm definitely keep saying I'm going to come down, but because of my location, completely different now. But I'll swing by at some point, and yeah, I'm looking forward to seeing that garden. Unfortunately, I've got a bad back, so I can't help with that.
Do you know what? It's flags at the moment. It's just flags.
That's
all
my
it is.
excuse. It's my back, unfortunately. But yeah, I want to come down and see it in action.
All right,
But
cheers.
I'll
Thanks,
send you.
Penny.
I'll send you some contacts for the volunteers, corporate volunteers. It's definitely the way to go. To get some manpower.
Thanks, love.
That's all right.
Ali, there's also a garden wholesalers called Sutton's. It's like a flower bank. There's a flower bank up in New Barnet as well, run by a lovely woman called Ursula. I don't know if she's still open, but she'll donate plants and flowers. And Sutton's will give you loads of seeds and stuff to plant in the garden, like flowers and stuff like that. Your charity stuff, and that will help get plants and stuff.
Thank you. Can I just say one other thing? This is like my own advisory team. I am looking for ideas, advisory members to be part of what I'm building. So if anybody wants to get involved, please hit me up, because this is exactly like I've wrote so much notes. Yeah, if anybody would like to be on my ideas advisory board, please drop me an email as well.
You've not been saying anything in a while. You went quiet on us. What's going on?
Who, me?
Yeah.
Busy
Well,
in the back
actually, I've
garden.
not been on in a while. That's probably why. You just need to share some things out there. Send some emails. Yeah.
I will. Thanks, everyone.
Yeah. Just ask and you shall receive.
Amazing. I was actually going to quickly just explain that the session, the next session would ordinarily be in 2 weeks from now, but 2 weeks from now is half term. So what we're actually going to do is bring forward the next full session next week. So that just to let you all know, especially our regular attendees, then yeah, it's next week, same time, Thursday, 4 to 5:30. But yeah, we just moved it because of half term. So yeah, I'll send a reminder out in the newsletter, and so hopefully people will get the message. But I thought I'd just explain that now. And we actually next week is going to be a session led by some of the academic colleagues, I think including Katie perhaps, talking about the work that they're doing and trying to measure the impacts of sort of household support fund and wider poverty reduction work. So there'll be a session mainly led by them to hear from community partners, people on the ground working with residents about what that looks like and how we can better understand how we can improve all of that work. So yeah, just a little shout out what's going to be happening next week. Yeah, does anyone else want to come in? We've still got 20 minutes left. If people they want to share or promote or ask about. Jenny.
Yeah, I wondered whether Katie was still on the call, because Katie's from that research team who I think is going to be joining us next week. And I wondered, yeah, I wondered whether you were still on the call and whether you had any sort of reflections to share. I think this is the first session of this that you've attended, and given the sort of nature of your research, just anything you would want to share about what you're going to be doing with us in Hackney ahead of the session next week. Sorry to put you on.
No, expecting that. Yeah, first time. I only joined the team about a month, 6 weeks ago, so I don't know the in-depth sort of background to everything they're doing. But what we are looking at is what's called strength-based approaches. So that's how we can help people to help themselves, to use the skills and the talents and the connections that they have to stop them falling into crisis, or when they fall into crisis, to help them find their way out again. So I think there's a plane going overhead, so hopefully you can hear me. We've done that in a number of different locations all over the country, and we're just starting to work in Hackney with you guys to look in particular at how the Household Support Fund, the money from that is being used by council organisations and by voluntary organisations like you to try and put that sort of long-term help for people in place that sometimes can take years and years until they see the benefits of it, but actually has a much bigger and a much more holistic and deeper impact than just sort of quickly putting a sticking plaster over it. So we're meeting with, as I say, with the leaders of organisations, so people like you. We're also trying to get some case studies, some journeys of the people that you help, how they think that they've been helped by you, the difference it's made. We're bringing it all together with obviously talking to the council and the data they've got as to what's going on. And we're using it to hopefully come up with tools, with a methodology, with plans for how Hackney can continue to strengthen this work that it's doing, and in particular to strengthen organisations like the ones that you run, to strengthen the voluntary organisations, because you're so absolutely crucial to all of this strength-based work, to all of this prevention work, because you're right there on the ground. It's not sort of being put on by the council, it's you guys, you're sort of the hands and feet of it all. So it's helping Hackney, particularly the funding around Household Support Fund is maybe not as certain as we'd like it to be. So helping Hackney really continue to make a difference and strengthen and grow the work that you're doing into the future. So that's what we're doing. We're going to explain a bit more next week about the help that we need from you guys to get sort of the data, to get the information, maybe to get the contacts to other people. So I'll wait until next week to explain a bit more about the practicalities of that. Someone's already been in touch with me about how maybe they could help. If anyone else thinks that they might know of particularly individuals who you've worked with, who have really interesting stories to tell, good and bad, we want to know everything, then please, my email is in the chat, so you get in touch. But I think just listening to you guys, I'm absolutely overwhelmed by just the networks that you've got and how you're collaborating and working with each other and just growing, all that help with the gardeners. It was just really, really beautiful to see actually how you're all just feeding into each other and helping each other to grow and to do more for the people of Hackney. So that's really, really great. I'm really glad that I was here, and we may also be asking you all a bit more about how we can help, or how you can be helped to grow those bonds between each other. Was that enough? I'll stop now.
Yeah, that's brilliant. And I guess just for those on the call who haven't heard us talk about it before as well, we really want to use the work that Katie and her team are doing to look at this in depth from a more independent point of view, to make the case for what's needed locally, but also to affect change, at national policy level, given where we are in terms of how difficult things are for residents, but also how much we've learned since the pandemic. So I think Daniel talking about, how much we've learned, how much the shape of what you do and how you work has changed so much, and there's so much learning, and there's so much that that I suspect the findings from the research will probably not be news to you, but it might help us to tell what you already know really matters to people, to different audiences in a way that carries real weight. So we really appreciate everything you can do in terms of submitting case studies, meeting with the research team, coming next week, whatever feels feasible for you. Equally, if you can't fill out the form, get in touch with someone in our team. We'll try and make it happen. We'll capture it somehow, either on a phone call or a video call or whatever. We really just want to make sure that we get the richness of what you all do day to day, because it's so critical, as Katie says, and we're really lucky to have this opportunity to have some independent expertise with some academic rigor to kind of help us to not make it all sound so vague and fluffy, and that there's something I mean, this is all the strengths-based relational way of working is quite hard to measure in a way that is well understood by funders and decision makers, and it's really hard, isn't it, to show the sort of financial implications of what doesn't happen as a result of what you do. That's really important. Yeah, great.
The more stories we can get, the stronger we can make that case. The more, it's called qualitative, sort of, rather than numbers and statistics. The more stories, the more people sharing of their experiences we can get, the better we can make that case, the more we can make the argument for what works and what doesn't.
Yeah, Krista, come in.
Yeah, just off the back of what Katie said, academic Nick in me is actually working on a big bit of work on my second Q2 report at the moment. So I'm doing a lot of work on behavioural science and the application of it to resident engagement. So I'm pushing out some stuff on that. I've created like a public health resident engagement Maslow, for want of a better word, alongside an impact map and stuff. Jenny's laughing. She knows I'm a right little neek for a bit of data, me, honestly, on the side. There's a whole other side for me. We've beaten, can I just say as well, that in breast screening survey land, so in breast screening survey, Sally's probably going to tap in for this because it's like a moment of joy. So the whole of the county of Surrey only got 100 surveys, and I think the original bit of work they got like 38 surveys back in or something from City and Hackney. Yeah, we've blown it apart. We're going to be like on 150 by the end of next week easily. We're well over 100 already. So, and that's just from the Hackney Marshes PCN. So I've gone into true academic dissertation research survey mode, beast mode. Become like a woman obsessed with a survey. And the reps, we've had 10 volunteers. Like, more importantly, we've had 10 volunteers working all over the community this month, doing focus groups everywhere, hooked up with a few through here with the Irish traveller community. We're at Chats Palace next week in the Homerton area. So off the back of what Katie was saying, maybe I can send you a copy of my report, Katie, that I'm pushing out next week. And if Healthwatch, maybe if you want to talk to Sally or something, a partnership or conversation can start.
Brilliant.
Because if we can support anything like that with the sort of the theory side of it, because I do have this thing, and I was like, everyone's probably thinking, why on earth did she put that in a reps progress report? But I feel like people just think, oh, Krista, can you just pick up the phone and find some people? Like, it's just that easy to just find the right people for the right focus groups. And it is about actually matching the right people to the right work that we're doing and stuff like that. And there is a science to it. Like, if you take patients with the lived experience who are at bottom tier, by the time we progress them through the system and the right people connecting the dots, they're then feeding back into the system. So there is an actual process to it. So I'm quite interested in what you're doing, kind of thing. So like, hopefully we could have a conversation, if that makes sense.
That sounds brilliant. My email's in the chat. Do you want to send me one?
Yeah, whereabouts is it? Is it
right at the top? It's k.adams and then the number 2 at hull.ac.uk. Yeah,
I'll drop you an email at some point next. No, I've missed the email. I think I might have come in a bit late. Could you drop it in again, please?
Yeah,
I think I might have missed. Oh no, I've got it. I found it at Hull. Yeah, no problem.
Okay.
All right,
thank you
very much.
Thank you.
Yeah, on that, I mean, we've talked in this meeting before about this fairer help work that we're developing, and we've got some consultants working with us, and this work is all going to interconnect. One of the workshops, I think we're going to see, Katie, whether I think that we're going to connect the dots with your work and theirs. And one of the workshops that they are going to help us facilitate will look to bring together people like your research team and hopefully Krista and Sally to a session that we're going to do on measuring the value of tea and toast, is what they're calling it, as in the relational work that we're all doing. So
That's
we would love.
Name.
It's a great name, isn't it?
Brilliant name.
So we're working with some consultants who have a lot of experience of work in this sort of work in different local authorities who are working with us to shape this work, and we'll have a bit of an update for you next week. I'll make sure that you get that, John, whether Rebecca and Jill can join us or not, because I think it's important that when we hear about that we can consolidate, bring all this stuff together, and if we can invite you along, Krista and Sally, as part of that, along with some other researchers and evaluation, we can kind of bring some of this together.
And I'm happy to present that kind of stuff, the impact mapping and the behavioural science stuff that we're doing to other partners, so they kind of feed into it as well, because it's all about connecting dots and stuff. So thanks, Katie. I'll definitely drop you an email about that, and thanks so much, Jenny.
Brilliant. Thank you both.
Penny.
Hi, just about gathering like the data and things. Does anything come off the back of anyone actually using Plinth, like after all the presentations and the meetings? Does anyone start using it successfully? Because when I tried to use it, I noticed that.
No, I've not tried it, Penny. I didn't even know what it was. I'm always open to good suggestions for anything, though. I can look into it, definitely.
I started an account and everything, but when I started to try and use certain parts of it, when, for example, like I think it was when it was about advertising, say volunteers or something, when you'd go on the drop-down menu to go on to the borough, Hackney doesn't seem to be present, but I think that was going to be decided whether or not Hackney was going to back it or fund it or something. It just shows up as like Camden and other boroughs, but Hackney's not on there. So I didn't know, Abby, if you knew if Hackney were going to fund it or not, because I know that you were part of the meetings.
Yeah, thanks, Penny. And that's gone on the back burner a bit.
Yeah, because I don't want to start something that's not going to continue. Don't want to waste my time with it if it's not going to be funded. Do you know what I mean?
Yeah, and I know that there are a few others who are using it, so I can put you in touch with, like, for instance, Manor House Development Trust. I think Shoreditch was also going to join them in testing Plinth out. A few others have contacted me about it, and I've got to follow up with Will as well.
Yeah, because I've I've just started playing around with Monday.com for the project management side of things, but I think it's still two separate things. So I don't know if anyone is familiar or can give any advice in general, like separately, obviously, if anyone's free for a chat on how they do things like Monday.com and then Plim for organizational side of things. If anyone is a super organizer and how they manage their day-to-day things, if anyone's got any tips and tricks on things like that. I don't know, just putting it out there for.
I'm a bit of an organisational neek, Penny. Maybe we could
Yeah.
have a chat. I'm a bit of a
Yeah,
anal
just-
person. I do love a post-it note, a clipboard, and a highlighter.
I'm just sick of looking at constant different spreadsheets.
People buy me post-it notes as a birthday present. I'm happy, so that should tell you the level. Yeah.
It's like, yeah, I just don't want to dive into the wrong.
Yeah,
the
let's
wrong
have a
system
chat.
and-
Let's have a chat. If we can have a chat, I'll drop you an email at some point tomorrow or Monday, and then if I can
Yeah,
help,
cool.
if I can help, we will. That
If you're
I
using any of
can't
them, and yeah, if you've got any tips, that'd be great. Thank you. Cheers.
Nice one.
I just
Thanks,
thought-
Charlie.
I just thought I'd share that I was visiting an organisation earlier today, and they also shared some kind of concerns around Plinth and some bugs that they were having difficulty with. So you're not alone in that, Penny. Just to say that some people have had some difficulty. I'll share those details with Abby as well, so you can follow up with them. But just thought I'd share that.
Thank you.
Not very organised at all, as you know, Penny. I kind of forget.
I'm sure not.
Thanks, Charlie. Anyone else want to use the next 7 minutes to ask a question of the group or promote something they're working on, or any ideas for future sessions as well? If you've got things that you want us to try and cover in these sessions, then do let us know. We're very open to all ideas. And yeah, especially if you wanted sort of like a more focused session on like a particular issue. I think in the past we spoke about looking at like issues around damp and mold, so that could be one idea to have a focus session on that. But yeah, anyone who wants to come in, feel free. Or we can wrap up at 5:23. Jenny.
I just wanted to flag, and I think we should put a link in the newsletter, the case study that Abby recently wrote for the Cooperative Council's Innovation Network case studies pack on system convening, given the work that Charlie and Hannah have been doing. It was interesting to hear from Daniel how useful that linking has been, and I just thought it might be interesting for this group to see that case study and see what's being shared with other councils about the work we're doing here. We'll share that in the newsletter, along with the previous case study on poverty reduction and our approach to poverty reduction and how this all works, because we are trying to share the learning from all the amazing work that you're all doing, and this session, even the connections that are made during these sessions are really helpful insight for us in why these sessions are so important in connecting up the dots. So your feedback's just been brilliant as always, and your collective collaborative approach to supporting residents in this space is always awe-inspiring. So a massive thank you, and we will share. We don't want to bombard your email with those sort of documents, but I think we should share a few of those links in the newsletter, because I guess it shows how this stuff is, how we're trying to tell the story of this way of working, to be able to kind of do more of it and to be able to support you to do more of the amazing work that you do. So just thank you all.
Thanks, Jenny. Right, I think we'll wrap up. Yeah, just a reminder, next week is the tool session, not 2 weeks from now. So if you join the link in 2 weeks' time, we won't be there. So, so just flagging that. All right, great. Have a good evening, guys. Bye-bye.
Thanks, everyone.
Thanks, everyone. Bye.
Thanks so much, everyone.
Have a
Thanks.
good night. Take
Bye.
care.
See you all. Thanks.